Welcome, I'm Jasmine with another episode of Scope. The Morobe Rural Command hosted the first Provincial Police Commanders Parade early March at the Eriku Oval in Lae. Host PPC Superintendent Jacob Singura inspected the parade in the presence of Assistant Commissioner of Police, Northern Command Peter Guinness. He stressed on the need to disseminate first-hand information to his personnel, as well as outline the expectations of the Royal PNG Constabulary and the national government.
The first Morobe Provincial Police Command Parade for 2023 was hosted on the morning of Friday, March 3rd at the Eriku Oval in Lae. Parade Sergeant Major Senior Sergeant Matthew Kawa led the two companies, comprising of 3 squads each, to the arena before handing over to the parade commander, Inspector Saki Boki. The first company was made up of provincial trained reservists, highway patrol and members from the police stations of Mudzing, Zivasing, Nadza, Buana, Wau and Menyamya. The second company comprised of Mobile Squad 15, the Water Police and the Criminal Investigation Division. After inspecting the parade, Provincial Police Commander Superintendent Jacob Singura said parades are crucial for disseminating first-hand information to the officers, as most of them are based outside of the headquarters in Lae.
Many times we send messages through black and white. Some members do have the time to read, while others don't. So through such parades, you will get information straight, direct, face-to-face. That is one essential element of a disciplined organization.
PPC Singura further outlined that this year has been declared as a year of law and order by the national government, where the Royal PNG Constabulary received 550 million kina, a 27.07% increase from the 2022 budget.
And has been taken fully on board by the Commissioner and his executive. What it means is for us to embrace it and appreciate the fact that the government for a long time has not funded the organization well. And with this massive funding, it calls for all of us to play our part. That is for us to work, commit ourselves loyally, with discipline, with honesty, and with transparency. We have to play our part so that what the government spends on us is materialized. It must be seen that we are happy, and the government, when the government makes us happy, we've got to perform.
PPC Singura outlined that some of the positive development within the RPNGC include the refurbishment of the Bomana Police College, which is now called the Center of Excellence, the recruitment of 500 officers to boost manpower, a refleeting exercise to replace the aging vehicles, and pay increments scheduled for this year.
It calls for all of us to work together, from the PPC down to the PSCs, section heads. You have to take account of your resources, the men and women under you, the resource that you have. We've got to play our part as commanders, as supervisors, so that the public can see us, that we are performing, not enjoying the privileges, and we're not giving back to our people. Our people expect the best from us, nothing less. So let's commit ourselves fully and do the job.
PPC Singura further said his command's performance on February 2023 was not pleasing. He outlined that from the 45 major crimes that were reported last month, only 2 arrests were made.
For minor crimes, which were reported for the month of February, we have 182. arrest 45, and pending 138. My question here is, does this reflect what we are doing? This reflects poorly on our performance, I must say. If I have been fighting hard with police headquarters to bring you fuel, now you have fuel of your own, I do not expect these results. These results should be much, much better. You have your own fuel to provide the service to the people. This is not good enough. The result speaks volumes. If we have not been working, this is a timely call. You work or you sip out. Find another job. If you like rail fuel, I fought through headquarters to bring you fuel. You must work. Me organizing workshop level service and car. There is no more excuses for you guys not to do your job. If I can play my part, you have to play your part as well. And it calls for teamwork. Let's all work together to improve on these very terrible results.
PPC Singura also drew attention to changes made in Section 5 of the Claims by and Against the State Act 1996. In the past, the state used to pay compensation for damages caused by members of the police force. Following the review of the Section 5 notice, Singura told his officers that they will now be held personally accountable for their actions.
From now on, any claims by any individuals, any organization, it will not be the state. Any civil suits, it will have to come out from our own pockets. So this fleshing out a minimum, we've got to be professional in the real sense. Do your job according to the rule of law.
PPC Singura challenged his officers to refocus and do away with police brutality, the abuse of citizens' constitutional rights, burning of homes and property destruction.
When we come back, Minyamya takes advantage of agriculture amidst many challenges with government services, and moral health workers concerned fearful of multi-drug-resistant TB. A 10-year agreement between the Hamtai Coffee Group of Minyamya and Agri Assurance was launched in January this year. At Kapau Rural LLG Morobe Province, with coffee said to be Minyamya's biggest export, the Hamtai Group aims to ensure their coffee trees against natural disasters.
The Kapau Rural LLG headquarters in Morobe's Minyamya district came alive on the morning of Tuesday, January 31st, with the milestone launching of the 10-year agreement between Hamtai Coffee Group and Agri Assurance Limited. Founder and chairman of Hamtai Coffee Group, Den Anas, said Minyamya has been producing coffee since 1950 with no district, provincial or national government support. Instead of sitting back and begging for support, they have moved another step forward by ensuring their prized commodity. Anas described his vision of coffee production in Minyamya as a 100 dream.
Me mangi place, me stop no big push. That's how me kissing 100 demand. Me no go to school. Me no pinisim UPNC. That's why me start big push na. Me kisi 1+103 man blow me. Wow Warrior District, Buloro District, Miniaman District, Tripla District, me play Hamtai Tribes, 12 clan stop. Karay me play no Rita, me play no Bombla Manico Pass me play. Kanay play me play 1950 to 2022, 72 years. Me play been cry. No Bombla Manico Pass no connection with the ball leader. Na bring you a kind money come house to and walk one time. Me one plus struggle man. Me come now me struggle na me put you black down please. You brother holy hand blow me. Na me holy hand blow blank. Na ba you moving Hamtai Tribes plus up.
This 10-year agreement from 2023 to 2033 is a first-of-its-kind insurance initiated by an agricultural group, and in this case, the 2,112 coffee farmers of Kapau Rural LLG. Invited to the event was Morobe Governor Luther Wenge, who was reminded of Hamtai's 50 million kina submission to his government in December 2022. In their proposal, the coffee farmers had asked for a coffee mill and their own export company.
We will by exporting coffee straight to the consumer. Yeah! Straight to the coffee table for America. Yeah! Straight to the coffee table for Germany. Yes! For Australia. Why is it export? Now coffee table belong Galilee, Lord Jerusalem. Fight the man. Yes! One problem minimum by come inside, long agriculture support. One problem minimum by Sabra Papa Fit Trust. All man we're going to talk you from back page. That's all Mr. Luther Wenge, Mr. Gosen. Also back face, that's what I say, you front face. Yeah! Okay. So that's going to happen. Let's talk fighting Andong brother. So Mark. Fighting Andong him, Islam. When you work on them, make sure that everything is insured. Coffee house, all other something, coffee car, all of them must be insured. We have an insurance company, so time fire, please no good to go. He's going to provide the insurance, by insurance, or the government will move it by work one time, Miss Animu. Yes, thank you. Then by step one to me play by answer him, we will give you a coffee meal. No worries about that one. Yeah. Thank you. Coffee meal. Me doesn't give him export license. Yes. Think of that point. Anyone man give me export license. You're right. You doesn't have. Why you tell me? Export license. Yeah. That's what you play no producer. I'm on. That's why license withdraw. Now you play producing enough. I make sure I give you the copy license, export license. Second time. Thank you, Adam. Thank you. My friend,
Tuberculosis is a potentially serious infectious disease, but with the current nationwide drug shortages, health workers are more fearful of the multi-drug-resistant TB. Health workers at the ANGAU Memorial Provincial Hospital in Lae are concerned that Morobe might follow the same path that Western Province was on.
According to the World Bank, tuberculosis infection cases have been growing at frightening rates in Papua New Guinea. Daru in Western Province, being one of the highest TB and multi-drug-resistant TB burden areas, was declared a hotspot for MDR-TB in 2014 by the World Health Organization. With the current drug shortages, health workers at the ANGAU Memorial Provincial Hospital in Lae are concerned that multi-drug-resistant TB will increase in Morobe. A health worker at the ANGAU outpatient said this week they have noted an increase in the number of MDR-TB patients from the catchment area at Buimo. He described the situation as scary, saying they can only control MDR-TB if initial patients who are on 6-month treatment are on medication consecutively, meaning no missing treatment and no running short of drugs. Treating MDR-TB is more costly than treating TB. This newsroom was told that it costs 15,000 kina for one patient for 6 months of treatment, while treating one MDR-TB patient is 50,000 kina for 11 months of treatment. On the other hand, it costs 100,000 kina to treat just one patient who has extensively drug-resistant TB. XDR-TB is a rare type of multidrug-resistant TB. Daro and the National Capital District have cases of extensively drug-resistant TB. TB officers in Morobe are fighting hard to get TB supplies to avoid this worst form of multidrug-resistant TB. Morobe Provincial Health Authority CEO Dr. Kipas Binga said TB drug shortage is a nationwide issue. He clarified that TB drugs do not follow the normal system of distribution. Rather, there is a special arrangement between the health department and donor partners like the World Bank and the Global Fund.
The recent drug shortage we have around the country is it's a national thing. It's not just Morobe, the recent one that we have. So it's a national thing, and I'll leave it to the national department to, but the concerns have been raised to appropriate authorities and was addressed. The drugs came, I think, about 2 weeks back or something. The drugs that came, it was distributed to the districts already. For Morobe, I was after some time, and this is something that I've been very concerned about, and I keep bringing it up to our team. So we've now written letters to all our TB officers in the province, warning them to give timely reports. Failing to do so will be regarded as insubordination, and they will be referred to the disciplinary committee. And part of that is to minimize the risk of drug shortage as a result of our failures or our late reporting in terms of reports coming late, and so you submit late requisition to the. So I would like to minimize that moving into the future. So if it's drug shortage, then it must be a countrywide thing. It's not because Morobe ourselves we have some problem in-house. And
Dr. Binga said the health authorities' disciplinary processes are slowly taking shape and will hold to account officers from the provincial level down to the districts. He said a number of officers have been suspended and put off pay because of their failure to report the need for new TB drugs. This means every other process that follows after report submission was delayed, resulting in the late delivery of TB drugs.
Few people we have already put them off pay, and in the district we've stopped them from coming to work as we were sent. So we would say warning to our staff as well and all ourselves to make sure that we comply in terms of report submission. So that's what I think the TB drugs. Currently now we have enough stock that is here now for us, but we would like to not to repeat this kind of things over and over. If it's anything, it's just something that everyone is facing together, not uniquely for Morobe. And that's the challenge that I have currently as a CEO.
This issue is not unique to TB drugs alone. It's the same with general operational drugs as well, with Dr. Binga describing it as a massive challenge for him and the Acting Director of Curative Health Services, Dr. Stephen James. Dr. Binga said when the general operational drugs are not coming through the normal supply systems set up by the health department, the Morobe Provincial Health Authority has no choice but to use the limited funding it has in its operations account to purchase the drugs that are needed. This in turn affects their other programs. The CEO emphasized that to recover some of the funding, they have to charge the public fees for the services and medical drugs that are provided.
If we got malaria, cost of service is less. So all we're asking for you is just about 5 kilo buy medicine. We don't ask you for 5,000 kilo. People complain, and then they're going to cheap way on the other side of the road. They complain about sleeping in the road, and they have time to go and smoke on the other side of the road. We're not asking. So these are some challenges that slowly we have to educate our people to be with us on this one. Police station, school. So we all have a responsibility to look after the services that we have.
After the break, some good news for tuberculosis testing in Hula Central Province. Lab encourages locals to come forward for testing. The new tuberculosis laboratory in Hula, funded by Child Fund PNG, the Central Provincial Health Authority, and the Hula United Church, stands to serve more than 14,000 people in Hula village and nearby communities. The TB lab will facilitate TB, leprosy, and HIV tests. This reduces the challenge of patients traveling the long distance to Port Moresby to access this service. The long travel coupled with high expenses discourages people from getting tested.
Last month, Child Fund PNG, in collaboration with Central Provincial Health Authority and Hula United Church, opened a TB laboratory in Hula Village. It was officiated by Child Fund Australia representative Michael Pine and witnessed by Central Provincial Health Authority Board and members of the community. Central Provincial Health Authority Disease Controller Panna Rim said the TB laboratory would ease the burden of making the long and expensive trip to Port Moresby to get tested for TB, leprosy, and even HIV.
Hula is one of the prime area for TB, HIV, leprosy, all these activity or TB diseases that exist in our communities. And for it to have a lab, this is a very, it's a milestone for you people.
The name of God the Father, God the Son, and on behalf of the people of Hula and the surrounding communities, I now hereby open this laboratory.
Child Fund PNG Director Anandas was also pleased with the setup of the TB lab and thanked the government for creating a conducive environment for such services to be done. He urged the community to keep the lab functioning to serve them.
I really appeal to all of you to use this facility because this is for you, and also to take care of the facility because this is your facility.
Funding for the establishment of the TB laboratory, of course, came from the Child Fund Australia.
I thank you as well to Mr. Burrow and Mr. Rim in particular for inviting me or allowing me to partake in this ceremony today. And the CPHA and United Church also, thank you to them for their role in helping to make this TB lab a reality. Child Fund operates in many countries and we seek to make the lives of people better in various ways. Health, of course, is one of the primary themes of what we do, and when we can make people's lives healthier, that is a wonderful outcome from our perspective. So I'm very privileged indeed to be here today to actually see an outcome of some of the work that the Child Fund team has helped to make a reality. And I'd just like to thank them, Amy, Anand and Olive and Amy and NAMI, the rest of the Child Fund team on the ground here. But I'd just like to add my congratulations to you all for making this a reality, and I look forward to it being a very successful operation.
I'm a community health worker at Hula Health Center, and I'm a disease control officer as well, officer in charge of HIV/AIDS, leprosy, and COVID-19 surveillance reporting and vaccination. I started working here in 2017 up till now. I am very happy that there's a laboratory installed by the Child Fund PNG to help us, assist us in our work, which is very challenging because we see around 14,000 population in our catchment, starting from Babagarubu village Liwali and coming up to Ula.
He said the Hula Health Center serves people in Ginigolo, Mugele, Kiapara, Alukuni, Karawa, and Hood Lagoon, a population of 25,000.
But the health center doesn't have enough equipment, I will say, and not to the standard of a health center. But we try our best to work and to serve the people. Due to the laboratory being installed, we are very happy because it's going to help us deal with TB in this catchment area, because our catchment is high reporting in TB disease, HIV, and leprosy. So we are very happy to have a laboratory installed, so it will make our work very easier to detect, and it will also help speed up our work in detecting those diseases, especially TB and leprosy.
Having the laboratory at the doorstep cuts down traveling time and lessens the risk of the virus being transmitted. However, there is still a major obstacle in the health service delivery. Medicine supplies always runs out.
And in Kotali, we do our supply order, but sometimes the supply doesn't come in time, which makes the facility runs out of medicine.
And that ends Scope this evening. A kind reminder to apply the following simple measures to prevent the transmission of the coronavirus. Regularly wash your hands with soap and water, cough or sneeze into your elbow, and exercise social distancing. If you are feeling sick, please stay at home. You can also call the COVID-19 hotline number for more information or assistance. Thank you for your company. Bye for now.